I would like to call Dr. Shroff Ashok sir to talking about the biometry, choice the right one. Thank you, sir.
Good afternoon, everybody, and thanks, Dr. Rajiv Chaudhary, for having me invited here to participate in your course. For sharp vision, we have to have a biometry, and we have to choose the right one so that we don't have any problem with the patients. We have to answer so many questions. Now, to see even for normal situations, it is very necessary because we have to have a precise eye power. It is a must, and now because the premium lenses to avoid the post-operative refractive surprises, and we want to have a heavy patient. Now, meeting with the patient's expectations, confidentiality, must have state-of-art technology, accurate biometry, advanced optical biometers, and appropriate formula. And to consider other factors also, to when you decide the power and the incision, you must know your surgeon factor. You must do the preoperative markings, particularly in the premium lenses and the toric ones. You must consider the special situations which you should cover in your counseling. And when you have some problem, you can go on online calculators. Newer generations optical biometers we have now, at least not at the personal level, but at very common centers. And we must take the full advantage of these, like IOL Master 700, Lenstar, and the Argus. They are based on different principles. Of course, till date, I mean, little before some time, the IOL Master 500 used to be the premium this thing, and the Lenstar. But now they have come with the more improvisation, and they are much better. They work on a different partial coherence interferometry, the low coherence interferometry, or the SIFT SS or OCT enhanced keratometry. So they are the different principles. But the most importantly, these instruments must measure the keratometry, the corneal diameter white to white, the central corneal thickness, the anterior chamber depth, the axial length, the aqueous depth, pupil size, lens thickness, and the angle kappa. And there are different formulas which are very popular, the SRKT, Hollandaise, Higgins, Barrett, Hopper's Q, and they have different applications too. So if you have a less than 20 millimeter, then you can have Hollandaise 2 or Hopper between 20-22, which is very common. You can again go for Hopper Q, 20-24.5 SRKT. At 24, more than 24.5, 26, you can go for Holiday 1, more than 26, SRK2. And whenever you have a problem, you can, of course, go online and find out the IOL power. See, usually, because I've been using since 500 IOL Master, and only two formulas, less than 22, offer Q, more than 22, SRK2, and if necessary, then we take the help of online calculators. And these are my observations. Even we have compared with the Hoffer-Q, Barrett, and you can see that, except these case where it was the SRK2 formula, the IOL power was 25.5, and the Barrett gave 24, and then we used 24. We went for the 24, and then the landing was 0. Of course, newer generation formulas, you can go, they are obviously available now, and we must use it. And this is very simple. They give you the all pictures where you put your torics, etc. There are some special situations which must consider. Of course, the percentage of overall these cases are very less compared to the normal one. But however, the dense cataract, posterior polar, post-LASIK, these patients are coming up now. More and more patients are for cataract surgery. Pediatric patients, iomyopic silicone-filled eyes. So you have to have modify the calculation. But the newer generations, they like Argus. They are now an IOL even 700. They give you the exact measurements even in these situations. See, where we have compared our data with the IOL Master 700 and Argus, we have two friends in Surat, and they have used this one, and we found that they are almost comparable, except the Argus, there where the plano was about 53%. Otherwise, it is all comparable. So we thank you very much, but let me tell you before I conclude, the best biometer is for yourself. The doctor is the best biometer. You have to apply your mind, you have to apply your experience, and then you can modify here and there so that you have a minimum, most heavy patients. Thank you.
I request Dr. Chaudhary, what biometer you use, and is there any advantage of?
I am using IOL Master 700 and Lestar. They give a more precise, and it has give an OCT imaging also macula, so you know the macular function also, and its penetration is comparatively better than
Even in
your
dense cataract.